and welcome back to another video. My name is Wannie and I am a junior doctor living and working in England. In fact, I am coming up to the final year of working as a doctor and I will be moving from my foundation year 1 post to my foundation year 2 post next week. So this transition period has got me looking back at the last year of working and thinking basically about all the things that I wish I knew or I wish someone had told me before I started my job in the NHS. So I'm going to split this video into 2 parts, the first half of which will be just general tips and advice I would give to anyone about to start work as a junior doctor, as a foundation year 1 doctor this summer. And that's essentially going to be useful tips and advice about how you can actually be successful in your first year of work. And the second half is going to be more general and more philosophical, if you will, about my thoughts generally about working in the NHS, working as a junior doctor, and again, some of the things that if you're considering a career as a junior doctor, all the things that I think you should know. So if you're only interested in one half of the video, there will be timestamps below which you can click and skip the less interesting things for you. So, number one is pretty obvious, but that is to be friendly. Try and make friends with your colleagues, with your seniors, with the nurses, with all members of the multidisciplinary team that you'll be around. It will make your life so much easier, and it will actually probably make you a safer doctor in general. If people feel like you're approachable, they're more likely to talk to you if they're worried about a patient or if they've noticed that you might be doing something not quite right. And also for me personally, I found that being on friendly terms with all members of the team I'm working with means that if I had a silly question or just needed a bit of advice, if I had at least had a friendly conversation with the registrar or consultant before, it makes that less of a daunting prospect. For other people, you might be really confident and that's a non-issue for you. But for me, it made those people seem a little bit more approachable and I was able to have those kind of conversations. So yeah, number one, make friends with your team. And so number two, download some useful apps. So number one, familiarize yourself with where to get your trust guidelines. This makes it a little bit easier if you're on call or if you're unsure about what to do in a specific situation. Of course, you can ask for help, but it's always useful if you have some kind of idea of what you're going to do and you can come up with some suggestions based on maybe some trust guidelines. Some other useful apps that I think helped me during this year. Number one, the BNF app, of course. When you're prescribing medications, it's your go-to. Double check if you're unsure. Another one is the induction app. This app allows you to set your hospital and gives you all the numbers to all the different locations in the hospital that you might possibly need. So if you want to call a oncology nurse, for example, or if you want to call a mental health crisis team, rather than waiting through switchboards for ages, you can just download the app, set it to your hospital, and call the relevant department. And a third and really useful app, which I downloaded later on in the year, and that helped me a lot, is the Foundation app. This app essentially has lots and lots of common conditions. It talks you, it gives you a really simple, clear guide on how to assess patients with these conditions, how to manage patients with these conditions. And yeah, it's just a really useful app. If you're about to clerk a patient, for example, just have a quick flick through on AF, and you've got that knowledge fresh in your head for when you go in. So those are some apps that I found very helpful, and I'm sure you will too. Number three is keep on top of your portfolio. So during your first year, you will be expected to show that you are competent by producing a portfolio with specific outcomes, clinical skills, etc. Have a very good idea of exactly what you're supposed to produce and when those deadlines are. It will make it so much easier at the end of the year. You're not going to be rushing around trying to contact and email the different SHOs and consultants that you've come across to sign things off for you. Make sure you know exactly what you need to do when you're doing it, and try and get as much as you can signed off earlier on in your rotations rather than later on. And lastly, number 4, have a good work-life balance. I cannot stress this enough. There is more to life than just work, and it is important that you leave on time, that you use up your annual leave, book up the annual leave early, and have some hobbies, activities that you do outside of work. It's really easy within the NHS, with it being so understaffed, to feel like you have to stay behind and you have to be the person that's doing all those jobs, that's helping everyone else on the team. And of course, it is a team sport. We all have to work together. But if you don't look after yourself first and ensure that you have a life outside of work, then you're going to burn out, and that's not great for anyone. So that leads me kind of nicely on to part 3 on my general thoughts about a career in medicine. So these are the things I wish I knew or wish someone had told me or clarified about what a career in medicine in the NHS in England means. So, number 1 is that you probably won't be earning as much as you think you will. And in fact, if you're thinking about career in medicine now, you're joining the NHS, you're joining med school, you definitely won't be earning as much as the older generation or the people who are now at the end of their consultancy career, how much they made during their junior doctor years. This is because the reality is that junior doctor pay is not keeping up with the rate of inflation at all, nowhere near. And actually, it's expected to get worse unless something is done about it. To put this into perspective, in the last 14 years, junior doctor pay has decreased by between 22 and 26%. Again, to put this into like stark reality, this means that if you're an F1 starting this summer, you will be earning 1 month less than what I earned and everyone else who's coming to the end of their foundation year 1 and moving to foundation year 2, 1 month less than us. So you'll essentially be working the whole month of August, for example, for free. And I don't want to sound cynical or put people off becoming doctors and joining the healthcare service, because, of course, money isn't everything. And if money was the number one priority for doctors working in the NHS, trust me, none of us would be doing it. But it's important to be real and frank about what's going on. And I'll actually link a really useful video I watched by Dr. Ollie Burton, who explains it really nicely and explains what's going on and what we can do about it. And that will be in the description below. So, number 2, I kind of touched on this when I was talking about tips for my junior doctor starting this year, and that is that it's quite easy to get burnt out. Understaffing is a huge issue that's always talked about, but what also people fail to mention is that that work still needs to be done. If there are gaps in the rota, those patients still need to be looked after. And who takes the brunt of that? It's the team that's there. So you'll be expected to do more work, be under more stress. And oftentimes it's lives on the line. It's the health of the patients that you care about. That's more stress, more work. And like I said, it's really, really easy to end up getting burnt out. Again, I'm not trying to be cynical. This is just the reality of it. And that's why, like I said, it's really important that you look after yourself. Try and switch off after you get off from work. And I know it's hard because it's dealing with people, it's dealing with emotions, but having that separate work life balance is important. But that's the reality of the NHS right now. Okay, so I feel like I've been a little bit negative about a career in health, but there are some positives that I didn't realize that I think is important to know if you're thinking about it. And one of them that I didn't realize is that the little wins are exhilarating. I think if you watch like these big dramatic health dramas like Grey's Anatomy, for example, it's always the big wins, like, you resuscitated a patient or this huge risky surgery has gone really successful that are celebrated and is like, oh my gosh, that's being a doctor. That's what makes it amazing. But actually, I found that it's the little things that have really made my day. As an example, I really struggled with doing arterial blood gases at the beginning of the year. I felt like I wasn't a good enough doctor because I couldn't do it. It seemed like a simple clinical skill. And I remember the first time I did it successfully by myself, I was like running down the corridor. I ran into my registrar's office and I was like, I did it. And he was like, well done. And it was just like the joint support was amazing. Another little win that I had the other day that was really like heartwarming was I had to tell a family member of a patient that their family member had cancer. And I hate those kind of conversations. I hate them. I think it's one of the worst part of the job, but you have to do it. And at the end of the conversation, she turned to me and she was like, thank you for the way you told me that. The way you delivered that news was really kind. And I was just like, oh, like it makes you feel like you're good at your job and it is really exhilarating. And it is just as amazing as, the big wins. And my fourth and final point that I guess I had some inkling on, but really didn't understand, is that the breadth and diversity within medicine itself and the kind of career you can have is absolutely huge. There is no one path to being a doctor, there is no one type of doctor. Um, I think there's the traditional training model where you do medical school, you do foundation training, you become an SHO and then a registrar and consultant. But more and more people are creating a career that works for them, whether that is travel, whether that is having a family and working less than full time, whether that is having a side business and working less than full time, or even having different types of specialities in one. For example, being an A&E doctor, but also working in expedition medicine and going on trips and providing your services there, or working as a consultant in cardiology in the NHS and then doing a few months working for a charity organization. Yes, there are so many different options. That makes me so glad I've picked this as a career. And you can create a career that suits your personality. You don't have to do the traditional pathway. Okay, so that's it. I hope this was an entertaining video. If it was, please like, share, subscribe, all the stuff. It really helps me reach more people and it also encourages me to make more videos. I loved hearing your thoughts and comments in the previous video, and I'm definitely going to work on some more stuff. If you want to keep up with what I'm doing or chat, then send me a message. I'm at Dr. Wannie on all the different social media platforms, and I look forward to seeing you in my next video. Bye.